Thanks for staying with us here on Sunrise. It's now time for cutting-edge training to meet transformative impact. And that's exactly what the Institute of Health Training and Academics, or the IHTA, is all about. IHTA CEO Lily Chambers joins us this morning to tell us more about what sets their training apart from the rest, as well as the tangible differences that they're making in healthcare workforces across the globe.
Good morning,
Welcome
Lily.
to Sunrise, Lily. How are you?
Good morning. Thanks for having me. I'm well. Thank you.
Beautiful.
Well, first of all, thank you for going away and not taking and keeping all that you learned away from Jamaica. Because what I get the impression in reading about you is that you're very passionate about taking the lessons that you've learned from your wonderful career and sharing it with Jamaicans. What made you say, I want to go back home and do this?
And help others.
Yeah.
Well, actually, most of my training is in the U.S. I studied nursing in the U.S. and I do have a passion for helping. And because of that, I started the Institute of Health Training and Academics. And what it is a Allied L program for CNAs, which is Certified Nurses Aid, and also Home Health Aid, which is HHA. And these are, the CNAs are support staff to nursing. At HHAs, there's some overlapping in function, but they mostly work in like private settings. And some structured institution like assisted living. And the basic function is really to help individuals with their daily activities, preparing meals, grooming, hygiene, helping them to eat, and ambulation. So I started this program really to help others because I was a CNA when I went to America. And I know how difficult it is for individuals to get their start. So to ensure that I help, I'm a member of certain aspect of the diaspora in America. And with this connection, I'm able to provide counseling to help people make next step in their journey. I'm open for any questions. I'm open to help in any form. Also, with this, I also am able to allow these individuals in the diaspora to see that they have the very basic that they need to have a program like this, to start a program like this to help them get on their career path.
Yes.
You know, Lily, Khadine, one of the things about this that fascinates me is because so many, particularly women in the diaspora, this kind of work is often their first job. You know, you hear, I'm taking care of an elderly person. Some of the time it's a relative, sometimes it's a church member. We tend to provide these kinds of opportunities, and it is their first, and sometimes they develop a career into it. But they often have no training, no experience. They learn over time how to take care. How important is it for people to get trained?
It's very important for them to get trained because it helps to protect them from injury. It helps to protect them and the clients that they take care of from injury. And there have been a big jump since COVID to ensure that individuals that work in homes, especially these private duties that you're talking about, that they're certified. It's either required by their employer, or, you know, like somebody's daughter or son, or as well as agencies that they might work for. So it is now, although they used to work like that, it's now becoming required that they show some kind of paperwork. And one of the things that's interesting is that I'm meeting a lot of these people that are already doing the work, but they don't have the documents to prove. And they're doing this not realizing that they have the very minimum that it takes.
What's the minimum?
So then, of course, they need to have a social security number or an ITIN. They need to have a state-issued ID. And that can be any state-issued ID. And they also need to have an high school diploma or an equivalent. If it's something that was done in a different language, then it needs to be translated. So that's the very basic that they need. And some people have these not knowing that they can move forward.
And qualify.
And yes.
So persons in Jamaica now, we're trying to understand, Lily, to make the connection, right? So what, you can get trained at your institution, and how does that help them here?
So the Jamaicans that I'm helping are mostly those in the diaspora. And they're being helped at that level, as well as I'm a member of the Guidance Center of Westchester. That's where my school is. And what they do is to provide support, training, and skills development for individuals that are suffering from homelessness, mental illness, some drug, substance abuse or use, as well as individuals that are suffering from poverty. And of course, you know, intertwined in all of that, you will have your single moms.
Right.
So right now, my reach is in America. And so anyone coming up, they can know where to
go.
They can know where to go.
And how long does the training? Because I know you got to go to school, you got to get training to get. How long does it last? And what cost are we looking at?
Okay, so the HHA, which it's less intense than the CNA. That's the home health aid individuals that work in private settings. That's a 3-week program at my institution, and that's like it's a 3-week program. And actually, at my school, it runs. The 3-week is really from Monday to Thursday. They have Fridays off. It's my school that generate their certificates, which is as soon as they register, they're logged into the Department of Health website and the Department of Education website. So I'm able to generate their certificates for them. The CNA is a 10-week program, and it's required by state, because everything is highly regulated, it's required that they also have 30 hours of internship.
Right.
So this is done in a nursing home setting or a hospital setting, which I have affiliations with. So that 30 hours, so it's really like a 10 to 12-week program.
I like that.
It's more intense than the HHA. And of course, with this internship, they also are tested. Their certificate is sent to them in the mail directly from the state. So they have to do a state exam, which is a 2-part series. There's like a half, which is multiple choice, it's written, and they have another half, which is practical. The cost for my HHA program is $600, with $100 being registration and supplies, which they get to keep some of the supplies. And for the CNA, it's $1,850, with $200 of that being registration and supplies.
Wow, amazing. So Dennis, there's no reason now. So you go overseas, you go to America, and you don't have to sit idly by. You can find Lily and find her school and get trained in 3 weeks or in 10 weeks, and you have a certificate from which you can make money. And just talk to me a little bit about that, Lily, real quickly. The earning potential of being qualified as a CNA or a HHA.
Well, there's a big range. It depends on where you work. On my website, they can quickly access the U.S. Bureau of Labor, which can take them, at least on my website, I have a link that takes them directly to the Occupational Outlook Handbook, where any profession can see what's happening currently in that field, what the prospects are for the future. So you have CNAs right now, especially out of COVID, they're making like almost $50,000 a year. Okay, there were CNAs during the time of COVID that were making what seems to be like a licensed practical nurse income. So they can tap into, if they go to my website, there's a link that takes them directly. They can just plug in what they're interested in, they'll see the current happenings, and they will see the prospect for that career path.
And what's the website?
The website, it's linked into the Bureau of Labor, but on my website you will see Occupational Handbook, Outlook Handbook, and it's www.ihtaa.com.
All right, well.
Wonder if we can take a vacation, Dennis.
You know, what you're going to need to do next is to have a training in Jamaica for the people who have aspirations of going away, so that they go there with the qualifications.
And that's the plan. So the plan, I'm currently working on having additional allied health programs like EKG and phlebotomy, certified medical assistant, and my ultimate goal is to have a nursing program with a global reach.
Yes. Wonderful. Well, we speak it into being. And Lily, thank you so very much for giving back and for sharing, because I'm quite sure persons in the diaspora this morning that are watching just had an aha moment, like yes.
This is what I'm going to do.
This is what I need, Lily.
This is what
Thank you so much. Lily of the Valley. Thank you. I love it. Thank you so very much. Our wonderful guest this morning, Lily Chambers, CEO of the Institute of Health Training and Academics.